right, thank you guys for coming. I always appreciate when people just sit there and stare at me while I talk. I think we can all agree that's a really terrible way to say that.
Totally.
Because that would be a form of indirect communication and a very inappropriate time of using indirect communication. So there are two types of communication. There are indirect communication and there are direct communication. Indirect communication is it leaves a lot of room for interpretation. It's not very literal at all. It's a lot of suggesting stuff, maybe hinting at something, a lot of implying something maybe. So if you were to say stuff like, "Oh man, I love how you can just leave the house wearing whatever," basically you're saying that her dress looks terrible. But it's a indirect way of communication, very passive aggressive way, but it is indirect communication. And there's also direct communication, which is very literal, it's very factual, it's basically an objective interpretation of what reality is, and so it tries as much as possible to not leave any room open to interpretation. It's good for whenever you want to make 100% sure that they understand what you're saying without any room for error. So direct communication is really good for stuff like when you're in a medical setting, because you're dealing with stuff like blood sugar, medicine, stuff like that, where if you're even a little bit off, then people could die, or people could mess up their lives or something like that. So where you want to make sure 100% that they get what you're saying and there's no room for error there. So they did a study with radiologists where they varied the amount of direct communication the radiologists did, and the more direct the radiologists were, the better off the patients were. So the more direct they were, they saw stuff like increased compliance with what the radiologist told them. They were more accurate with taking their medicine. They saw better results on the medicine because they were more regular with them. Stuff like that, because the radiologist made it very clear what was expected of them and the patients understood them. And so one of the issues with direct communication, though, is that sometimes it can be seen as a little confrontational, because you're basically telling someone what you believe to be the factual basis of reality, and so if they have a different idea of what reality is, then basically you're telling them they're wrong. And so sometimes that can lead to confrontation, especially for people who don't like to be wrong or get offended when someone tells them that they're wrong. And so with indirect communication, the opposite. It's very open to interpretation. It's not as direct. It's not confrontational at all. Basically the complete opposite of direct. And so with that one, they did a study in relationships in Chinese culture. And so what they found was that Chinese women, the more indirect communication they used, the happier their relationships were. And so the reason for this is because, one, Chinese culture in general is just a lot less literal than American society, but also Chinese society is they focus a lot on saving face, and so whenever a woman would basically disagree with their husband or something, by being indirect, the husband was able to save face, which is basically you're not embarrassed, which is like a huge concept in China in general, which we don't really have as much here. And so there's not really, I wouldn't say that there's a good or bad. Indirect are both very valid methods of communication. There's not a wrong way or a right way. It just kind of depends on the situation that you're in. So again, stuff like with medical stuff, then it's better to be direct. But when it's stuff like emotional stuff, then it's a lot of times better to be indirect, and maybe be a good chance to show an example of when direct versus indirect communication. Jordan, if you would like to come on up real quick, I have some news to tell you that you might not be love. So I don't know if you agree, but I really feel for people whose goldfish died. This is me telling you that your goldfish is dead, Jordan.
Oh.
Yeah. And I know this is not the best time to tell you, but it's dead as it gets. It's dead fish. So, yeah. Okay, you can sit down. So with that, it's again, I was implying that his goldfish is dead, but I wasn't saying for certain that his goldfish is dead. So it's like it leaves room to interpretation. And whenever your beloved goldfish is dead, you don't want to leave room for that. You want to know for certain. If your goldfish is dead, you want to know because you love Guppy. He's a great fish. Anyway, so they did another study in healthcare systems to where they were focused on preventing suicide, and that one they showed there was a lot of both indirect and direct communication, because when stuff like that, you need indirect communication whenever you're actually talking to the patients, because you don't want to be confrontational with them at all, because they're already in a very fragile state right now, and you want them to open up. And a lot of times when they're talking about their feelings, that feelings are generally just indirectly communicated because they're not as concrete, they're not factual, they're just how you feel on the subject. And so you want to be learned in indirect communication and talking to them, but whenever you're translating that to your fellow employees about a patient situation, you want to be very direct so that everyone has an accurate assessment of what's going on. So that would be direct and indirect communication. I don't know if you guys have any questions. Yes, Anna.
Do you think there's ever a moment where you should be 100%, like in a full conversation, indirect, or 100% direct, or is there always like supposed to be a mix?
I mean, I think it's definitely up to the individual. I don't think there's a clear-cut answer in my opinion. I don't 100% direct. I think there are a lot of situations like doctors, for example, you want to be 100% correct. You want to be 100% direct, factual, because you don't want a doctor's analysis necessarily or his opinion on your sickness unless it's like a medical opinion. You don't want to be like, oh, you have cancer, that sucks. Well, okay. So, you know what I'm saying? Indirect, that one, I can't really think of any situation where, just because the person I am, where indirect would be best, but I'm sure it exists. It's just up to the individual. Anyone else have a question? Maybe one more?
Why do you feel like indirect is not appropriate as opposed to direct?
So I don't mean to say that it's inappropriate, but in medical, I would say sometimes it is inappropriate just because, again, lives are at stake and you want to make sure that you're getting information across as accurately as possible, and indirect isn't exactly best for that. But there are definitely times where indirect is a good method of communication. Like, for example, in what we do, we're social workers, so you want to be learning indirect communication because when people are talking about their feelings, that's the way they talk a lot of times, is indirect communication.
I got a question. So, do you feel like you were saying with the Chinese women and Chinese men, is it better to be indirect with certain genders and more direct with others, or is it just depend on the situation?
So they did actually, in that study, they also found that men are way more often use direct communication, where women way more often use indirect communication. And they said that they thought, basically in the analysis was basically that because most societies are, especially Chinese society, is a very patriarchal society, so the women a lot of times are conditioned to like not confront men as much as the opposite were men confronting men. So there is definitely a gender breakdown of that, and it's definitely not concrete, but women way more often utilize indirect communication, while men a lot more often than not utilize direct communication. All right, well, if there's no more questions, I appreciate you guys being here, and have a good one.